Hello everyone and welcome back to The Marbella Way. Today's guest is not just a plastic surgeon, he is a wizard of wrinkles, a magician with a scalpel. He performed more than 13,000 plastic surgeries and beauty procedures. He is the one and only Dr. Jonathan Sykes.
Hi, it's great to be here.
Thank you so much for coming here.
Yeah, thank you.
I have so many things to talk about, but maybe we should just start because it is the Marbella Way. And we have to start with the daily dose of the Marbella Way.
Yeah.
And you open it today.
To celebrate life.
Life celebration is good.
And that you came.
So what are we talking about today?
We're talking about business and lifestyle. First of all, the Marbella Way, the reason for that title is that we lived there for 13 years. And
Whoa.
we actually call that area the California of Europe. So it's very interesting to meet somebody who actually is living here, working here, and knows a lot about this place from a professional point of view and a lifestyle point of view, so that we can get inspired.
Yes.
So what would you like to know?
So now we talk about the California Europe, but now we are in California. So let's just start to talk about California.
Yeah.
Because you lived here your whole life. Not the whole life, but you moved...
Half my life, maybe.
Half of your life.
Yeah.
You moved away from New York to here.
Yeah. I grew up in South Jersey.
Cheers.
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 I grew up in southern New Jersey and did all my education on the East Coast. And I moved out here because I had an obligation with the military, which is how I went through school. They paid for my school. So I had to give them back a couple of years, and they sent me to Northern California. And many, many years later, I've stayed. So that's how it's worked for me. And the California life and medicine have been really good to me. It's allowed me to work hard, which you don't know when you're young if work is the thing for you, but I like doing my craft and probably will do it till I'm 80 years old, believe it or not. That's my plan.
How did you get inspired to pursue such a career? What was it that initially inspired you about beauty and medicine?
It's an interesting sort of thing as to what makes you go into it. Medicine is wonderful because it gives you so many options. If you want to treat patients, you can. If you want to sit in a quiet room with radiology and just look at x-rays, you can do that and almost never talk to a patient. You can do pathology and never talk to a patient. So you can do lots of different things. For me, what was really important was using my eye to diagnose. And I've trained that really well. And then being able to see the fruits of what my eye saw as a vision. To me, it's like being a little bit of an architect or a designer, in my case of only the face. I only do the face. But it's like being an architect of the face, how you can change that but still make it look very natural. That's what has inspired me, and it continues to inspire me.
But how did you find out? Because like you're sitting there drawing a painting when you were a child. Like how does it come up?
Yeah, I think you go into medical school and you try some different things. You're going, and then at first I said I want to be a surgeon because I like the passion of being a surgeon, and I didn't really mind working hard. Some people want a quiet life and they want to be a dermatologist, or they want to, and it's not that I didn't want to use my brain, but I wanted to use my brain and then see what I did, see how I applied that. So, and then I thought, what kind of surgeon do I want to be? And I really liked the anatomy of the face. Okay. And interestingly, as my career has gone on, and I've had an over 35-year career in medicine after my training, the anatomy has been revived, and now at a relatively late in my career, I teach anatomy to people all over the world. Commonly, I'm speaking about anatomy or doing cadaveric dissections to train people, to train surgeons, and to train injectors who see the face but don't know what's underneath the skin.
Yeah.
So to me, being able to do that is great. So I often say this when I teach. I do at least one cadaver dissection per month, teaching for a teaching reason, every month. So and it's kept me fresh as a surgeon. So I think being able to work and enjoy your work is a great gift, because so many people are not passionate about what they do every day, and it's at least a third of our lives. So if you're not, sleep is a third maybe, and working is a third approximately. So if you, it's half of your waking life.
Champagne is the other third.
Champagne is, so it's medicine has enabled me to do that, as you know, as my other passion is making wine, so it's enabled me to do that as well.
So there's this artistic side of it, the craftsmanship that inspires you. What about the whole aspect that you're helping other people as well?
It must come with a big responsibility as well when you go in.
It does. It comes with a big responsibility and a big expectation, because some of the time the expectations are outside of what can be done. People that are aged want to look like you. I can't do that. I can't make them. I can make them better, and sometimes I can make them a lot better. But I can't. Sometimes, and this is more of a there's a big psychological part to doing aesthetic surgery, the psychology of it, and I've gotten to. I actually lecture a lot about that, because I've had to think about it a lot, because there's a beauty to what I do, and that is I make a lot of people happy, but occasionally, rarely, thankfully, I make them so that they're really not satisfied. And when they're not satisfied with themselves, they naturally get really not satisfied with me.
Sure.
And so that's a difficult thing. And understanding that psychology is really, I'm part a psychologist, as anybody that does hair does, or is an esthetician and does facials. You're a little bit of a psychologist. But for me, the psychology is, what do you want and what do you expect? That's true about life in general, but what do they expect from what I'm going to do for them, and do they match? Do those two things match? So that's become a very interesting thing for me.
So you traveled around the world many times, and also teaching, do master classes.
Yeah.
Did you see any difference between the beauty ideal if you are in, for example, in the US or in Europe, or is this the same?
Well, as you know, that's one of the things that's made us friends. I'm a lover of Europe and the European people and European culture. The diversity of it is wonderful, and the passion for style is wonderful. I think in general, and I don't like to make broad generalizations, but people in Europe are a little more conservative about the way they may change their appearance and what they want done. They want their lips a little smaller. I don't do body surgery, but if they have breast augmentation, they want that a little smaller. In California, everything's big. The butt's big, the breasts are big, the lips are big.
And the food are big.
What's that?
The food, the portions are big.
Proportions are big, and the people are big.
The cars.
But the cars are big, yeah.
And the roads.
And it even goes to the opposite thing. Like, I do a lot of nose surgery. I change a lot of people's noses. They want that small. A little, like, if you go to Switzerland, if they get their nose done, they want it natural. But if you go here, they want it small. They bring me pictures of people who have Instagrammed or morphed their noses smaller than what they are, and they say, "Yeah, that's what I want." And
see, that was a very interesting question I actually had, because I was thinking, there was so much tendency in the social media of filters, for good and bad. Let's just say that. Do you have people coming out like, "Oh, I have this filter, I look good, I want to look like that"?
All of the time.
See, I thought that.
All of the time. And it's they morph themselves, they change themselves, they want to look like it. And some of the things I actually can do, and some of the things I cannot do.
I would just add that although I'm a huge fan of Michael Jackson, I think his nose got a bit too small at a certain stage. I wish he had met you on the way.
Yeah, exactly. And ironically, his primary surgeon was someone in Beverly Hills that has passed away, and I am operating and and in the office of the person who was his son, who was also a plastic surgeon. So I'm in the office, and we've redone that office of the Michael Jackson surgeon. So it's an interesting kind of thing. But
talking about your office as well, because it's very, very different than any other places I've ever seen in my life.
It's very, well, I have a passion for art, and we've tried to put a lot of art in this office because I like coming to a place like that, and it's stylish. Interestingly, as you know, I have a big passion for teaching, and I do that all over the world. And this weekend, I was in Colombia, in Bogota, Colombia, and I taught on the faculty of a small course there. But one of my dear friends, his name is Jorge Espinoza, is a plastic surgeon, but also an artist. And I went to Bogota and took some art classes with him, and I bought several of his pieces and lugged them back from Bogota. And I tend to gravitate towards people who like other things than just medicine. They like wine, they like art, maybe the Marbella way.
It's totally the Marbella way.
But I believe
maybe that's why you had me here today.
we talked about why is it, but we just felt that it was right, but we had to really discuss what is the purpose, but it could have something to do with your taste for aestheticism, like for beauty. Because I remember you explained that you try to really pursue natural beauty. So,
you're very present when you come there. You feel very good when you enter your office. It's not like you're coming out with a white, sleeve.
Sure.
Yeah.
Well, the thing about, it's not natural to have plastic surgery. It's sort of it's an oxymoron. It's like, military intelligence, they shouldn't go together, those things. But when I say natural beauty, I want to change people and not make them look like they've had an operation or an injection or whatever it is. And that's particularly true in the face. I only do faces. I think when people do their bodies, they want something outside of what might be natural. They don't want to go from an A to a B or a B plus cup or even a C minus. They want to go to an A to a double D. They don't want a little bit of fat in their behind. They want a lot. To me, I don't like it when patients come to me and they say, I want my lips really big. I don't want them natural. I almost think you should go to someone else because I'm not really the guy for you. Because I don't enjoy that, and it's even though I want to please my patient, that's my first goal, to satisfy your patient. It's hard to do something that you don't consider aesthetic. You're very right, Martin. Aesthetic things are present in all of my life. Just the way I pick furniture, the way I pick lights in my house, the way that's the way I look at things, and I want to come to something that is aesthetically pleasing to me. And so when I change a face, I want to change that in a way that doesn't look, the nose isn't over scooped or over pinched or over lifted up. I want it to be balanced, or what I would say, what a pretty nose looks like that hasn't had an operation. That's what I'm trying to do with an operation. It's a sort of a strange kind of thing. So, but some of my patients, they tell me, I want a very done-looking nose. I want a scoop, or I want it very elevated, or and that's a tough thing for me.
It must be tough to compromise your ideals, but to satisfy the client.
Yeah, exactly. It is a two-headed monster.
But I think it's fascinating because if you think about, I know it's completely different, a car or a house. Certain cars look like the only purpose is to come from A to B. And a house, you can live in it, but it's not necessarily looking that great, but it was built. But then other houses and cars are just very beautiful.
Right.
And I remember we talked about France, Italy, Spain, and there are many beautiful things there, including cars and so on. And it's just interesting that you have that artistic approach.
But it's interesting, in Europe, there are very beautiful things, but function is important. Like in the house, function is very important. And so, to me, form and function should go together. It's not just all about form.
Yeah.
Form and function. So when I change somebody's nose, I want it to function its best. I change the function as well as the form. And so it's sort of an architectural thing for me to do that. and I think that about my house, I think that about my office, and I think that about people's faces. So.
And it just is, we talked about it, very comforting. You feel safe when you enter your office. I think most people who are not used to be in a clinical environment
get very nervous.
Can get a bit nervous when it's very, I don't know, very different. Seems a bit abrupt. It's a big intervention to be in such an environment, but. With your furniture and it's very cozy.
It's like walking
really
into a living room. You feel
makes
good
you feel
when you are there.
very much at home.
Yeah, that's.
And
I guess that's the intent. Yeah.
I think a lot of women deserve the honesty you have and also the respect for the aesthetic look as well, because a lot of people in Europe don't have this honest opinion or have the honest, feedback from a guy like you.
Well, I think that's why I've never worn a white coat. I don't wear a white coat when I see patients.
I get nervous every time I see a microphone.
So I either am like, I wear a suit most days, or if I'm operating, I wear scrubs.
Yes,
I wear pajamas.
Yeah.
But I never wear a white coat because it's not clothes that I would ever wear anywhere. So I don't, your white coat looks great. It's not white, but that looks fabulous. But I don't wear a doctor's white coat because it just doesn't fit who I am.
So the change from the East to the West Coast, how did you experience that? And are you happy about that change? I mean, New York is great, but what's the West Coast like?
Well, it's been a long time since I lived on the East Coast, and now my parents became old and both have passed away. My dad would be, as I told you, dinner would be almost 101 now. He died when he was just shy of 100. And so I don't have as many reasons to go back to the East Coast now. And I felt that it's a little more formal. Parts of that I like, actually. People dress up a little more on the East Coast than they do out here. And that part I like. But it's also, there's a little more anxiety there. I guess we're in LA and there's a little more anxiety in LA. I think people in LA are more anxious than they are in Montana. So there's a trade in everything we do.
Everybody is more anxious when they see people in a suit. It's like,
I mean,
what's going on here?
I think drivers are more anxious here because the traffic's
very true.
bad, and they're more anxious. They get more angry. Anxiety creates anger, and they're more anxious. So and I think that's heightened in New York, in Los Angeles, the two places.
Interesting.
But on behalf of your clients, I'm happy that you reduce the anxiety by not wearing a white outfit.
Right. So one thing that has been a great thing for me, and it's sort of kept my career interesting, and it's gotten me to Europe a lot of times, is all the teaching I've done. I try and fit that in to my clinical practice, and last fall, I think I told you I went to Europe 3 times, even though they're short bursts. But I went to Croatia, I went to Italy, I went to Verona, Italy for meetings there. And to me, it's, I love Europe. I like the diversity. I like the people there. I like the style there. So it's a wonderful thing. I have to get to Marbella.
You have to go to Marbella, absolutely.
I've been to Spain.
Marbella needs you, that's for sure.
We recommend the Marbellaway.
Yeah, Marbella. I've been to Spain many times, but not to Marbella.
So you know a little bit about the Spanish lifestyle.
Yeah.
And what about your European roots? Huh? How are they together?
So my father, who was born in 1923, so we're in 2024, 101 years later. My father's grandfather was born in the Ukraine, and my mother is from Germany and Czechoslovakia, or her family. But they were both born in New York and Philadelphia, and so I went to college on the East Coast, and I have a draw to the East Coast, but I like it out here.
But you travel sometime as well too. You also have a clinic in Napa Valley, in Sacramento.
In Sacramento, and I have a Medi-Spa in the Napa Valley. So I travel some to do things, and then also I travel to do volunteer surgery for children, which I've done in many countries, which I think grounds you a little bit when you go to last last June I was in Guatemala, and I've been to just many, many countries, to Bolivia, to El Salvador, to Honduras, to, you know, to many, many countries doing this kind of surgery. And to me, that really isn't about the country, it's about the people, it's about helping the world a little bit. And I think it's great to be able to help and not have a price tag on that, just to help for help's sake. You know, they call it pro bono surgery, and people think that pro bono means for free. Everybody thinks it means for free. It does not. Bono means for good. It means for good. So you're trying to do some good in the world. We don't care if they have insurance. We don't care where they came from. We're just trying to help them. And usually on those trips, we're trying to figure out how many surgeries we can get done safely and help more people during that week that you're there, or 2 weeks. And so it's, and I just came back from, as I said, Colombia, and I saw a person that I've known for almost 40 years that I was a resident with, and he has a foundation called the Hugs Foundation, like hugging.
Yeah,
and
Hugs Foundation.
that's who I went to Guatemala with, and I think I will go back to Guatemala this year with him. But, you know, I really feel great when a person like that does a lot for the world, because he's going a few times a year to Vietnam, a few times a year to Guatemala, and he takes a lot of these trips. And it's a good thing that we're successful enough that we can take that time off. But I would rather do that than take a vacation, to be honest with you. I feel
totally
better about
understand what you're saying.
myself at the end of that week than I would if I went to Italy on vacation. So
It's very beautiful that you travel the world to help children.
Yeah.
But do you then deviate from your normal focus on the face in these cases?
I'm mostly doing cleft lip, cleft palate, cleft noses, some craniofacial surgery. So I stay on the face, but maybe I'm not lifting wrinkles or, you know, or doing nose jobs for just an aesthetic sense.
Absolutely.
These are people with congenital problems in their nose. So it is a little different, but and it's always interesting to go with some very good surgeons and see them down pulling up their boots. They're doing what they need to, starting IVs, doing, you know, it's a good feeling. Maybe it's selfish. It seems like we're doing good for the world, but maybe I'm being selfish because I'm getting something out of it so much.
But I believe those two things are totally related.
Yeah.
Because what is really, really good for you, not good, but really good, is normally good for others as well.
Yeah.
So I think it must be, but it's a beautiful purpose to have, to travel out and help children.
We tried it in a different way when we travel around the world with our kids, because we have been living on the go in the hotels for more than 3 years. And when we go to Thailand, for example, people are living in the streets and they are happy. Some of the people are happy, generally happy. They give a lot of themselves.
Right.
And I think it's very important to teach your kids, you know, there is also another life than this you have. Appreciate it.
It's an interesting thing about that. I've been to Cambodia a bunch of times, and the person that got me going to Cambodia was a friend of mine from Seattle, and he had adopted a Cambodian child. The child is now 28, but he adopted him when he was 1 year old. So I've known this guy for many years. So I went with him a few times to Cambodia. And I said to him one time on one of these trips, your son, his son's name was Liti. I said, Liti must be so like happy and that he's with you and he's successful. And he says, well, I think so, but I don't know that he's any happier than he would have been if he grew up there, because we really can be happy anywhere and with anything. That's a framework. It's a mental way that we look at the world as to what makes us happy. And so, you know, you can be happy when you buy a beautiful pair of shoes, and you can be happy when you help an old person across the street, you know, as they'll be doing with me in a few years. But you can be happy with any of those things. And I'm actually very happy when I help an old person across the street. You know, that makes me happy. So it doesn't mean to say I'm not happy when I get the shoes,
Yeah.
but I'm very happy doing those kind of things. I find that grounds me. It makes me, and you know, I talk a lot about my father, who, you know, to you and to others, and even on my Instagram, I talk a lot about my father, who just passed away, and he was happy with a very small amount. He said to me, you know, things don't make you happy. They do not make you happy. They may make you happy right when you get them, but then that fades very quickly.
That's for sure.
It fades very quickly.
But when we talk about this, we talk about material things and immaterial values. I like to refer to one of our Danish philosophers called Søren Kierkegaard. I don't know if you've heard about
Kierkegaard,
him.
yeah.
But one of his points, he wrote a book called Either Or. And the conclusion, just in brief, of that book is both and. So he's basically saying that it's not either or, it's both and. So I think we can appreciate sometimes certain things without being totally lost in materialism. You know, some people may be, but yeah, there is some kind of balance in between.
Yeah. I mean, I think we like material things when we're younger. As we're older, we realize we like peace and we like happiness and we like, you know, being kind. So, and my father would always send me a card, he would send me a card at the holidays or Valentine's, and he would always say, be kind. He would always say that on the card, be kind. So I always remember that.
That's why I think you are such a special person. And it totally shines through whatever you do, the work, when you either teach or whatever you do. Be kind, and you are that.
Yeah.
Definitely.
It's very rare to meet, and I mean, I'm not trying to judge all lawyers and doctors in the world, but it's at least very nice to meet somebody where the human being shines through. That may be a really qualified expert sitting here, but you feel the human behind as well.
Yeah. I've practiced for a lot of years. As you know, I have a practice here in Beverly Hills, and I have it in Northern California. I practiced for many years with a guy that's originally was a New Yorker and has moved to California many years ago, like I did. And he turned 75 a few days ago, and he doesn't work that hard. He's got a good balance in his life, but he's always grounded me with some of the things he said. And he said, you know, like at the end of your life, you won't be saying, oh, I wish I would have operated on one more person. You know, that's not what you say. You don't, you know, it's, but you will think about people will think about you, as Maya Angelou said, for the kindness that you gave them. And they will think about the way you make them feel. And I've received many things of thanks in my whole life. Cards and gifts and wine and this and that. And the best card I ever had was, I worked for many years at the University of California, Davis. I was on the faculty there, and I had a big practice there. And somebody gave me a card, and she said, I've worked here for 15 years, and I'm leaving, I'm retiring, and you probably don't even know my name, but every day you came to me and you asked me how I was and how my family was every day.
It's very, very nice. Very sweet. Yeah.
That was the best card I ever had. Yeah.
This is this personal, you know, interaction to have
personal
with people.
touch. Yeah.
But it's in the end, it also comes down to if you like other people, that's what matters.
Yeah.
And it shows that you have shared your interest in other people. Yeah. Even though you may have had a position where you didn't have to.
Yeah.
Yes.
Yeah, I think you always should. We don't have to, but we always should. We always should be kind. You know, we always should do this. So, anyway, I have to go to Marbella and.
You have to go to Marbella
and see this. Tell me about Marbella.
I don't even know where to start. There's a lot to tell. You know, the biggest difference between, I could ask you that, what is the biggest difference between LA, Los Angeles, and Europe? But I think the biggest difference is that if you are there or here, Marbella is a place you go when you just need, okay, I need a timeout. I need to plug out and tap into a world where I don't have to think about anything.
You need peace.
Yes, you need peace. It's like a health environment, a beautiful place where either if you want to look for a party or you want, to go in yourself or have a retreat or just do healthy juicing or whatever it is for kind of purpose, you go to Marbella. It's a place. It's fun it's a fun place to be.
Maybe to relax your mind.
Yes.
Definitely.
Relax your mind. Yeah.
If the party side doesn't carry you away.
But it's more, I think actually, it's not actually, I wouldn't say that it's a party place. Ibiza is more of a party place. But you have social experiences that you can choose or not choose. And that I think is a big strength about the place, that you can be as social as you want and as little as you want. But you always have the choice. People are very social, both the Spanish people there and the international people there. So you'll never have to feel lonely, and everybody is open to talk and curious, because nobody is really at home. They chose the place as a home, but they're not playing on home field.
I always call it like a time loop in a way, because I always think about Alice in Wonderland. You jump in that hole, and the world is just...
It's going on around you.
Yes. And suddenly you're out of Marbella, it's like, hey, I was just in a time bubble. What happened? Like, life was so good, and now I'm back in the reality. Yeah. It's a place to enjoy life. It's definitely a big place for beauty, Yeah.
And it's very interesting that more and more American people came, especially last year, the last 2 years, more than ever actually. So that's a good development, that we're able to attract people from here as well.
That's wonderful.
So hopefully we will see you there one day.
I hope so soon.
Thank you very much for your time and coming here today.
Thank you.
And if you want to know more about Jonathan and you think, hey, I need to get hold of this beautiful team and go to this fantastic office in Beverly Hills, you can find him on drjonathansykes.com or find him on Instagram. Thank you very much for following the Marbella Way, and we are ready with more Marbella dose in just a minute.